Hi, everybody at the Inclusion Collaborative. Dr. Amy Hanreddy and I, Samantha Toews, are really excited to be here and share with you some of our current emerging research in the area of parent perspectives on distance learning for students with extensive support needs. So today we'll be sharing some preliminary findings and some promising practices based on a survey we're currently conducting and some investigations we've been doing as a collaborative group with people from the California State University, Northridge, and several local charter schools and districts.
So just to kind of start us off, so the survey that we're doing is really focused on understanding the experiences of families of students with significant support needs. So we just wanted to take a second to kind of define who those students are. So in general, that category of significant support needs might include students who experience complex communication needs, complicated medical or health needs. They might fit into the federal disability categories of intellectual disability, multiple disabilities, and autism. But more importantly, maybe they're also a category that's also either underserved or underestimated. And we also know that this group of students often faces wide discrepancies related to their access to services and supports in the least restrictive environment. So, and now I'm going to kind of state things that I think most people watching this probably already know, but let's do a quick summary. We know that almost every school and district in the United States stopped in-person instruction in spring 2020 as a result of the coronavirus pandemic, and remained in distance learning for the remainder of last school year. And most school districts have started this school year also using distance learning. Currently, we're seeing that some schools are beginning to bring some students back for in-person instruction, but even in this time, we know that distance learning is probably going to continue in one way or another as a strategy to serve all students over the coming months, and maybe in some places for the remainder of this school year. We also know that students with extensive support needs are likely to continue to need to engage in distance learning, and yet these students and their families also face some really unique and additional challenges when they cannot attend school in person. So understanding parent perspectives then is really critical during this time, because these are students with extensive support needs. So they need a lot of support from their families. They need support to engage in day-to-day activities, but they also need extensive support to access the services and the routines as part of their distance learning program. And so to understand this really critical role was a key purpose of this study. So our study aims are really to gain an understanding of the experiences, the needs, and the desires of parents or caregivers of students with exceptional support needs related to distance learning, and really to figure out how to use this information to best support educators to design programs during the COVID-19 pandemic, and as I mentioned, beyond, because we're really thinking about how understanding distance learning might help some of those students who were already struggling to access in-person education.
All right, so I'm going to talk a little bit about our research questions. So far through our project, we have explored and are wanting to find more information about the experience of caregivers of students with extensive support needs who are participating in distance learning, and what factors might impact those experiences. So factors such as access to technology, or the type of class their students attend, or the specific support needs of their students. And then what are some of the common forms of service delivery being provided to students with extensive support needs, and which of those supports are the most useful for caregivers. And so what we have done is we're conducting a mixed method analysis, a mixed method research study, in which we're taking quantitative survey data, so frequencies of responses to questions, and statistical analyses of the relationship between characteristics of parents and students, and the feelings they have about the supports they're receiving and their students' access to their education through distance learning. And then we're also using qualitative interview data and open-ended survey responses, or open-ended survey responses, to really gain a deeper understanding of what are caregivers' needs and desires during distance learning. And the reason for this, as Amy had mentioned, is to better support teachers, schools, districts to develop accessible distance learning programs for students and families of students with extensive support needs. So I'll talk about the data we have so far, and as we've mentioned, this is an ongoing research project, so we have not completed our data collection. So currently we have 31 responses from caregivers primarily on the West Coast, but we are recruiting from across the country and the world, so we have a few spread out responses as well. Our caregiver respondents are primarily white female caregivers who have completed the survey, and these caregivers are most frequently from 2 caregiver households with 1 or 2 students with extensive support needs. And you can see from the graphs down here at the bottom that most of the students of these caregivers attend traditional districts, but some attend charter schools. And then when the parents who selected other, please specify, most frequently indicated that they have pulled their child recently from school and are doing homeschooling. And then as far as the typical income of families, they were typically taking in $75,000 or more as a family. So that just gives you a little bit of the demographics of the survey respondents we currently have that we'll talk about today. So one of the things we wanted to look at was how COVID-19 and this change to distance learning has impacted caregiver employment. And some of the really interesting pieces of information that we got from this is that 84% of caregivers who completed the survey responded that they themselves or someone in their house had increased workload or responsibilities during this time. But that also 86% reported that care for others has impacted their ability to do their jobs, so to do their work. So this switch to distance learning and COVID-19 in general has had an impact on the way caregivers are completing their work or feeling they can complete their work. So how has COVID-19 impacted home life? So we can see here that 95% of caregivers said that they themselves or someone in their house has had to take over in teaching or instructing a child. So that clearly is connected to the previous slide where 86% of parents said that that COVID-19 has impacted their ability to complete their job. And then we see also that 64% say that they don't have access to, or they have had struggle accessing babysitting or childcare when needed. So this is having an impact on families. in that way. Difficulty taking care of children in the home has been impacted. And we really wanted to see if this extra time with family had improved relationships with family and friends. And the blue is no. So we can see that most caregivers were not feeling that COVID-19 or distance learning had improved their relationship with family and friends or had improved quality time with those people. But also important to note from this particular sample is that most of these families do not have difficulty accessing a sufficient number of electronic devices, which is important to understand in that there are families that are struggling to access sufficient devices and sufficient Wi-Fi. So currently in our sample, that population is not represented. So that's just important to keep in mind as we go forward. So looking at the impact of COVID-19 and distance learning on caregiver physical or emotional health, I'm going to just show this slide of things that we looked at really briefly, but I have a summary slide later, right now. So to summarize some of the main takeaways of what has impacted caregiver physical or emotional health, 100% of respondents reported that their mental health or somebody in their house, an adult in their house, has experienced increased mental health problems since the beginning of COVID-19. And then 76% responded that their children's mental health has suffered since COVID-19. So this is taking a large toll on both parents, caregivers, and children's mental health during this time. And to be more clear about what was considered mental health, is some of the examples we gave was increased anxiety, stress, depression. I think these were the main ones that were there. 55% of caregivers reported that they've experienced increased physical strain in the home, and this could have been from increased need or times to lift or position children who need support to access their environment, their physical environment. So parents are most likely supporting their children throughout the day when they would have been at school, so that the number of lifts and positioning that they're having to do is significantly more. And then 89% reported sleep problems among adults in their home. So now looking at what parents or caregivers are hoping their children gain from their time during distance learning. And I am going to summarize the top 5 on the next page, but you can see some of the tasks here that we gave for parents to select from. But the top 5 were caregivers hoped to have their students increase and develop more academic skills during across all academic areas during distance learning. They hoped that their child would engage in more activities independently, develop communication or literacy skills, remain connected to peers, and increase their ability to follow a routine with independence. So these were the top areas that caregivers really wanted their students to make progress in during distance learning. And so these are the areas that teachers and program developers should be in focusing on in their development of distance learning programs, understanding that this is what many parents are looking for, and still taking into consideration that the study is in progress, and we will still need more information from a diverse group of parents, but so far this is what we have. So now we're looking at what types of supports are important to parents during distance learning, and what they find are important for them to receive to be successful in distance learning. So I'll summarize that, what was most important on the next page. So what parents wanted from their distance learning program was live times for educators to interact with their child, live times to support social interaction between their child and peers, live class meetings, inclusion in general education distance learning, and live times to interact between the teacher and the parent. And so these are in order of how of the most parents wanted, who wanted each of these things. So they're in order of popularity or importance. So with live times for the educator to interact with the student right there at the top. So now we're going to look at what has been part of distance learning for students with extensive support needs and how useful parents feel each of these service delivery models have been. So on this slide, the types of service delivery on the left hand of the screen are in order of how useful parents felt they were. So parents felt live times to interact with a parent between the teacher and a parent was the most useful support for them to receive. But then on the right side of the screen, you can see that online resources sent home for a child was the least useful thing support that parents identified. So I'm going to go through from most useful, the 6 most useful useful strategies parents felt were useful to them and their child, and how frequently parents said they were receiving that support. So as I mentioned, live times to interact with a parent was the most useful support identified, and about 62% of parents who completed the survey were receiving that support. Live times for educators to interact with their child was the second most useful, but only 54% were receiving that. Inclusion in general education distance learning was the third most useful. 58% of students received that support, or caregivers and families. And then live times to support social interaction was also meaningful for caregivers, but here also only 54% of students are receiving that support. Educators providing a schedule to caregivers and families was useful, and most families were receiving that. And then live class meetings were also identified as a great support, and most families were receiving that. So we can see that most families are receiving these ones that are they're useful to families, but they're not the most useful or meaningful activities for families. So if we're thinking about increasing access to certain supports, increasing live times to interact with the parent, increasing times to interact with the child, between the child and their peers, and increased time for children to interact with their teachers, and increased time for students to access general education distance learning are going to be things to target with redesigns of distance learning programs. And then one thing we wanted to highlight is that even though parents and caregivers identified that online resources sent home for their child to complete was the least effective support that they're receiving, almost all parents, 93%, were receiving that support. That doesn't mean that it needs to be entirely thrown out, but it's important to identify that, these top 4 items that were the most useful are not necessarily the things that are being provided the most. So now we're going to look at some of the greatest challenges to caregivers during COVID-19. And right up at the top, which, connects well to what parents were saying about their levels of stress and physical exertion, is that 88%, 89% almost of caregivers said personal fatigue, anxiety, and stress has been the greatest challenge during COVID-19 and distance learning. And then next up there, high at the same percentage, was the biggest challenge being supporting a child to access distance learning while also needing to manage other responsibility. Loss of social interactions was also a major challenge for caregivers, and also one of those things that caregivers really wanted and felt was useful for children to receive during distance learning. So that's one of those areas we should be thinking, how can I infuse more access to peers during distance learning? How can I set up social interactions and increase that for all of my students? And then experience of burnout and frustrations based on the needs and demands of supporting their child was also high. And so one of the parents responded and said, I enjoy working with my child, but it's stressful for me and my 3 other children to always be together and not have a break from one another. So this is something that's contributing to all of these areas of stress, is that parents and children don't have breaks from one another. They don't go to school and then come back. They're not going to work and then coming back. So this time together isn't necessarily improving relationships, as we saw in a previous slide, that parents didn't feel that this was a time that was improving relationships with their families. We also asked some questions about time spent doing distance learning and student enjoyment of distance learning. So you can see that most students and families were spending 4 or more hours a day accessing some aspect of distance learning. But most students were not enjoying distance learning at all, or only slightly or somewhat enjoying distance learning. 0% of parents responded that, only 3.85% of parents responded that their child was very much enjoying distance learning. So this is something to keep in mind And so some of the quotes that parents provided were, one of my twins is okay with it half of the time and the other isn't interested at all. So different children might be experiencing distance learning in different ways. Another parent said, my special needs daughter requests school bus daily on her iPad. She needs physical engagement with teachers and aides. There are students who are really asking to go back to school, and that's not possible right now. So it's I'm sure frustrating to many parents and students. But taking all of this information into consideration, we wanted to know, are parents ready to send their children back to school, and in what capacity? So we've just gone through many slides about how distance learning is stressful for parents. It's a challenge in multiple ways, but parents are still saying that 58% almost of parents are saying they would not send their child back to a physical school at this time, despite all of these stressors. And some of those reasons were, one parent said, my child was born at 24 weeks and they're very susceptible to illness. We are extremely careful and I will not risk their life for school. And then other parents were saying there are some situations in which they would send their child to school. So some parents said yes, they would only send their child to school for one-on-one assessment, about 20% of parents. Some said they would send their child for one-on-one instruction. And then some said that they would send their child to school at a reduced capacity with masks required and other health precautions taken into consideration. And then there were 15% of parents or caregivers who said that they would send their child back to school in the same format that children attended school previously. And one of the quotes from a parent was, "I would only consider it if I can get forms signed by all that they have not had contact with anyone that is sick, and they themselves are not sick and being careful." So these are some of the sentiments from parents about returning to school. And then we also asked for what are some silver linings. And we did provide a variety of suggested silver linings in our survey. But the most selected item on our survey was increased knowledge of their child's educational program. But in general, about 50% of parents and caregivers selected other and typed in their own silver linings. So some of those to share with you are increased independence with self-care, such as showering and dressing, as we aren't in such a rush to get to school in the morning. Another parent says not so much driving and rushing around. So those are, connected there. Less driving, more time to work on things that parents would typically work on at home with their child in terms of independence, more time for private physical therapy. One parent said hopefully better visual focus. I'm imagining because students are focusing so much on tiny things on the screen. And then this is an interesting one, increased support for my child since I'm providing it at home. Teachers have been very open to suggestions as we are all learning. So we know collaboration between parents and teachers is key because parents have a unique and deep knowledge of their child's support needs. And so this distance learning organization is providing increased opportunities for parents to know their child's educational program, know how to support them to access this, and then to collaborate with teachers so that teachers will know how to provide those supports both during distance learning and when students go back to school. So those are some of the silver linings that we wanted to share.
Okay, so in listening to all this data kind of be summarized by Sammy, I think that one of the things that just I kept thinking was that this is confirming in so many ways things that many of us have already been hearing anecdotally from families. And so I just wanted to kind of summarize some of those major takeaways that are now supported by this data from parents in the survey. So first, again, we already knew this, and this survey is really starting to confirm that parents of students with extensive support needs are under great strain. And it's strain to meet their own needs as well as the needs of their children. At the same time, these parents are maintaining really clear expectations for learning. They're not giving up. They're not saying, we're just gonna, sacrifice my child's education for the sake of our family or our own mental health needs. They're continuing to remain committed to those things, particularly academic, communication, and literacy skills. Another thing that was really clear from the data so far is that even though social interaction was one of those key things that was very important to families, they were much less likely to have social interaction supported by the school compared to some of the other elements of their distance learning program. Parents report that their children do not really enjoy engaging in distance learning activities, which to me is just such a clear takeaway in terms of our design of those programs and instruction. And maybe we really need to be relooking at, getting more creative and thinking outside the box in terms of how to facilitate greater enjoyment on the part of our students. And then finally, that many parents will continue to choose distance learning due to their child's health concerns. And then just this quote up here says that it's been disappointing that some staff are focused on their own schedule and compliance with district guidelines rather than listening to parents on what works best for our children. So I think that that quote really kind of summarizes part of the purpose of this survey, is that, you know, as educators, many of us are concerned with so many different things at once, but we really need to make sure that we're kind of stopping and listening to families so that we can make this work for these families and these kids. So next, we just wanted to kind of use some of this information we've gathered so far and share some of the strategies and tools that we've been working on with this community of practice that Dr. Toews was referring to earlier. I know I called you Sammy earlier. I was like, okay, Dr. Toews. And I think that one thing that we've done is really go back to what do we know are already evidence-based and promising practices for students with extensive support needs pre-COVID-19. So if you look at that list on the left, we already know that these students need access to meaningful instruction in context, that they need designing these programs well requires high levels of collaboration, coordination, and teaming across professionals and families. That we need to focus on embedding communication and literacy instruction within everything we do because it's such a high need for these students. Progress monitoring and formative assessment need to be ongoing. Social supports and relationship building, self-determination, age-appropriate topics for students, and that close collaboration with families. These are all things that were essential before COVID-19, and I'm sure that as I'm listing that, we're kind of hearing a lot of connections with the things that families are asking for now. So the same things are things that need to be core elements of our distance learning programs for students with extensive support needs. So on the right-hand side, we kind of see it's checked all the way down as these things are still important for students post-COVID-19 or during distance learning. I guess we can't say post. Should be during, I guess, COVID-19. And we're talking about context and access to meaningful instruction, that we're going to add home and community routines in addition to the context of general education. And then we just added a star at the very bottom there that this close collaboration with families is kind of the keystone or the core piece of all of the rest of the program. So, so we have been kind of developing and collecting different resources and materials to support the design of distance learning programs that are really geared towards students with significant support needs. So those are all compiled on this tool. It's called a Padlet. It's kind of just like a big bulletin board, and the link is there. There's also a QR code that you can if you don't want to try to copy down the link, you can just hold up your phone to that link and use the camera, and it'll take you right to the page. And on the left-hand side of that Padlet are all different resources that are geared around these guidelines that we've been working on kind of refining with all of those key elements. And there's kind of some summaries of those guidelines and some tools that are associated with them there. And then in the column right next to it is some of the professional development that is really focused on distance learning for this population, some of which has been provided by other great professionals all around the country, some of which has been developed by our own community of practice that we've been kind of pushing out. And there's one there that was put together by our statewide, California statewide chapter of TASH, which is a whole bunch of teachers really talking about strategies that have worked for them.
And we'll also paste this in the chat. We'll paste the link for this in the chat since this is a recorded presentation, but you'll be watching it live, so we'll paste that in the chat too.
That's right. Oh, the other thing I wanted to mention here is that we also have some related presentations that are part of the Inclusion Collaborative conference. So we're doing, in addition to the ones that are on the Padlet now, there's also a presentation on supporting social interaction and there's one focused on family support plans, which I'll be talking about, I think, next. Yes, there they are. So one of the tools that we've found to be really helpful, and I know has been, they've been adapted and shared and used now in a lot of schools and districts, is just a tool called the Family Support Plan, which is just an outline of what we would consider to be a individualized meeting where we meet with each family to talk about their kids and talk about their students' needs. And just, it really aligns with many of the questions on the survey. You know, what's going to be most useful to you during this time, and what are you already receiving? And then it's just a strategy to kind of work together with families to integrate learning opportunities throughout each day. On the right-hand side is a family check-in form, which is meant to just kind of be a follow-up after doing the family support plan, to work together on refining the program and embedding key skills like IEP goals within some regular activities in the home. This is a tool called a goal activity matrix, and it's a tool that's been around forever. It's one that I learned about when I was in my credential program to become a special education teacher. And on the left-hand side are goals, and on the top are different activities. So what we've done is just really think about how this could be adapted for distance learning in collaboration with families. So we can choose together with families a couple goals to work on each week, and then work on what would it look like if we embedded those within some regular activities that are things that the family feels that they can provide at home. So things like the example at the top says reading a book. So maybe there's a book of the week that they're going to read at least one time a day. And then the second one is counting. What are some things that we can count? And then we'd look at what skills we can embed within those counting activities. Mealtime and a daily walk or outside time. Those are things that many families have said they can easily embed it within their routines. And then the examples there just show how, for this particular student, we kind of worked in some very specific strategies to support communication and her math goal within all 4 of those activities. So you can see we built in some very systematic instruction around just some typical activities that a family had designed. And this is available on the Padlet, and there's also a blank one available on the Padlet. All right, and then just, you know, I think that another one of the takeaways are also some red flags or things to avoid. So thinking about the family feedback, thinking about the things that they said that were less helpful, and also considering what we know are kind of evidence-based or promising practices for these students. So red flags are things like isolated skill practice. So if anything that we're providing for families to do at home that are kind of like those skill and drill types of activities are likely not going to improve enjoyment and are also not going to support generalization that these students need. Over-reliance on those online resources, so especially those asynchronous online activities. Dr. Toews already kind of mentioned that those were seen as least useful among families. As we're thinking about whole group instruction or even small group instruction for students online, when we don't have a clear idea for how students will respond or participate, then that can be seen as a form of exclusion of students with significant support needs. So even though they're there, they're not able to actively engage in the instruction. Minimal or no time accessing general education curriculum or peers. Unfortunately, we're seeing that some students are becoming more isolated from general education during this time, again, despite the fact that families saw this as a critical goal of their time during distance learning. A lack of focus on communication and literacy. So especially when we're using like prepackaged curricula from districts, sometimes those don't really have an adequate focus on those core skills of communication and literacy. They might be focused more on specific content as opposed to those underlying like really critical skills. So we have to be really strategic about how we provide those. Anytime our program is developed kind of only by the educator side and is not developed in collaboration with the family or home support team, that's a red flag. And then finally, just an inability to adjust supports and services based on how things change. Things can continue to evolve and change with new restrictions, new knowledge about students or strategies. And we also have to be able to adjust based on evolving student or family needs. What a family wants right now might end up evolving as things change, or as they've engaged in these activities for extended time. They might have more ideas for what will work and won't work for them. And we need to be good about listening to those things.
Gotta unmute myself. All right, so we are going to open our time now to questions, but I just want to say that here are emails if anybody has any questions. And we also, as we've mentioned, this is an ongoing research project. We are still trying to collect a wider sample of parents to share their experiences so that we can best support teachers and schools and districts to design accessible distance learning programs. So if you would want to share our survey with parents that you know, we have links to the survey in English and Spanish. I will drop those in the chat, as well as drop our flyers in the chat. So at this point, we would love to open our time to questions from the group.
Great.